So Juvederm and Restylane are both what we call hyaluronic acids. Hyaluronic acid is a substance that we find in our skin naturally. So it makes a great filler for helping us out when we want to fill in fine lines and wrinkles. It also can be very helpful when we want to give volume back to someone's face who's lost volume. As we age, typically our mid-face or upper cheek area does tend to descend a little bit, creating more lines here in the nasolabial folds and also in what we call the jowls. If we try to fill those areas, it is very helpful in helping people to look younger. It is something that we try to do during facelifting all the time. And the idea can be either to fill the line directly, which is typically what's done. I believe it's something like 66% of the time. The way these products are used is to inject them directly into the line that's bothering the patient. Other times we use the same product to try to fill up maybe the upper face, which sort of mimics that facelift I talked about because you're regaining volume in this area and it helps to pull this nasolabial fold away. Either case is a nice solution for a problem that everyone starts to develop as we get older. So today's fillers typically last about 9 months. Now some of them will give you a range, purport to last anywhere from 7 months to maybe 18 months. It really depends on the product. But whether or not it's a hyaluronic acid or calcium hydroxyapatite or any other product that's available today, for the most part, you can probably bank on 9 months to a year in my experience. Some of this depends on exactly where you inject it. So when I inject lips, for instance, they really don't stay plump for very, very long. I would say 4 to 6 months is a pretty good stretch for the lips. On the other hand, the nasolabial folds, the mid-face, the tear trough right in this area here, products injected in these areas last quite a while, certainly a year, and sometimes much more than that.